My name is Chase Colton Woodward. I am a medical doctor and orthopedic spine surgeon. I also have a master's of public health degree. From a young age, I knew I wanted to be a spine surgeon because my dad was a spine surgeon, now retired. I always admired my dad growing up, and I knew what he did was important. I'm originally from Omaha, born at Emmanuel Hospital, and I went to public school here. I'm really proud of my educational background. I went to Northwestern in Chicago for undergrad and medical school, University of Pennsylvania for residency, and then finally Washington University in St. Louis for a year of spine surgery fellowship. I knew I wanted to come back and be part of the Omaha community and raise my family here. One of the great parts about being a spine surgeon is collecting all the data that a patient brings. Being a good spine surgeon is like putting a patient's puzzle together. They bring a bunch of pieces with them to the office. It's their story, the examination. More pieces are the MRI and the CT scan. And you have to synthesize all of that data to make a diagnosis and come up with a plan for the patient. If something is not adding up, I approach it very cautiously. My approach to spine surgery is to start with the most conservative treatment measures first, and that might mean some medication or physical therapy before we start talking about interventional treatment. What sets me apart from other surgeons is I like more complex cases. I feel like I'm able to manage them and deal with them. Maybe it's someone who's had spine surgery before and they need another opinion, or someone with a scoliosis or deformity that might be a little outside the practice of a community spine surgeon. The more complex cases, they're certainly more challenging. The patient often has more to gain in those cases. They have great disability that you can help reverse, or maybe they've had pain for a long time that other providers haven't been able to treat, and it's so satisfying for me and the patient when we're able to fix those issues. There's just a lot of pride in our practice and being able to take on the most complex cases in the region. The decision to undergo spine surgery is a huge decision for people, and it causes a lot of anxiety, and part of that anxiety is people don't understand the anatomy and pathology and the treatments. I think it's very understandable that people might want an expert opinion or sometimes a second opinion, and I'm very sensitive to that and empathize with that, and I'm happy to do it. My advice to someone considering spine surgery is to learn as much about the process and experience as they can. And there's a lot of resources that our practice and hospital offers. Certainly do not feel shy about asking me questions. There's nurses at the hospital and nurse navigator system there, and they are very happy to walk through the process. My experience has been the people who understand the surgery and hospital stay and recovery the best are the most satisfied, especially in that post-operative few weeks. One of the common misconceptions about spine surgery is that you're going to be bedridden for weeks and months after surgery. That's not true at all. In fact, patients are up and moving around the next day after spine surgery with either a nurse or a physical therapist or one of their family members. Part of the early recovery is mobility. I think that goes against the grain of what most people think. What sets Nebraska Spine Hospital apart is the expertise of the staff, not only the surgeons, the nurses, the operating room nurses, and then the nurses on the floor. From top to bottom, these people are great, and we work as a team together. And it's that expert experience across the entire group that makes a big difference. Physician leaders in our community, we take seriously educating the other medical providers in the community and our patients. The high quality throughout your entire stay.